So welcome to Fast Forward Plus Hangout on Air. We're here today to look at some very high impact, cool social innovations that are aiming to end poverty and change the way we can deliver development and health to people around the world. So joining us today are Gilad Tanai from Academic Stand Against Poverty, who's joining us from Yale. We also are joined by Jake Hirsch-Allen from Health Impact Fund, who is joining us from Toronto. And we have Kat Tully, who's here from over here, an international foreign policy advisor who's joining us from London. And we are lucky to have such a great group of people. I'm going to call on Gilad to jump in and tell us a little bit about the impact project you're working on with Academic Stand and how that might be helping policy advisors and all of us looking to make a difference to end poverty.
Sure. So first of all, what is Academic Stand Against Poverty? So we call it for short ASAP as an acronym. And what it is an international network that aims to mobilize those academic resources which are unique, underutilized, and still untapped towards achieving real-world poverty alleviation outcomes. Now, in particular, we're focusing on one high-impact process, which is the process of formulating the new framework that will replace the Millennium Development Goals after 2015. So, as some of you may know, around the year 2000, 193 countries signed an historical document agreeing to make great strides with an unprecedented ambition towards eradicating poverty and human deprivation. The expiration date for these goals was 2015, and now 2015 is around the corner, and something is going to replace the Millennium Development Goals. Whatever that is, it is likely that it will set the global agenda for fighting poverty for the next few decades. And our goal is to make sure that academic inputs and the good work done by poverty experts from various disciplines feeds into this process and helps steer it towards a direction that will fulfill the original promise of eradicating global poverty. The thing is that there's a gap. There's a big gap between the ideas that are there in academia and the real world of policy processes that actually shape what's going to happen with poor populations over the world. Now, there are several reasons for this gap, and they're systemic and part of the very nature of academia. The first is academic inputs just come in slowly. That is the nature of the work. But what is needed, especially with urgent things like the Millennium Development Goals replacement, is haste and meeting the schedules which are political and not academic. Another thing is that academics tend to give a priority to nuanced theoretical disagreements, to showing in what way I am different than the other person, rather than clearly stated where we agree in terms of practical policy recommendation. And finally, it's part of the nature of academia nowadays that we work in a micro-specialized and insulated way between our different disciplines and super-specific specializations. But it seems to me that what's really needed from us is to articulate a multidisciplinary bottom line in a big picture recommendation for the new era in development. So this tension between what is needed from us, from the world of policy, and what we are naturally inclined to do is creating a real problem that I'm afraid might lead to us missing the opportunities to impact the new global framework.
So looking at how this seizes that opportunity for impact, it's very exciting and I think important to tease out that real-world agenda that you are seeking to accelerate by building consensus that's cross-disciplinary and really inform the process so that we don't miss this opportunity and we don't miss it in the short term. You know, that this agenda is ASAP. We need it as soon as possible. So let me just turn to Kat and invite you to put that new framework into a policy framework. If you're looking at real-world outcomes, how does this matter? How does this make a difference in health?
Thanks, Diane. Yes, in fact, ASAP is really quite revolutionary. Up until now, academic insights have really tended to be used for political purposes not always used in unbiased ways. This is a way that academics can help set the agenda. They've got a lot to contribute in terms of insights on poverty, on health, but in particular on understanding accountability and power, on a lot of areas like engagement, how to improve engagement with poor people, how to ensure that the people who are supposed to be the recipient, the people who are living in poverty, that they participate in the process, how to improve the governance of the system. These are all areas in which academics can really make a difference and really contribute.
So in looking at accountability, at power, and at engagement, let me turn to Jake to tell us a little bit about Health Impact Fund and how this initiative is looking to address a particular aspect of development stemming from our awareness of the agenda set by the Millennium Development Goals and where we might be going forward with greater accountability and engagement, incentivizing innovation and change.
Thanks, Diana. So the Health Impact Fund is a project that was proposed a number of years ago by a group called Incentives for Global Health, based out of Yale, like ASAP. The project is now very international, and the idea is to create a fund that would be an alternative to the current patent system to incentivize drug development. So right now, there's a fundamental problem with the way that we motivate companies to produce pharmaceuticals, which is that the drugs themselves or the drug companies are paid based on the patent monopolies that they hold rather than the impact on a population's health. And our goal is to flip that equation on its head and instead pay out based on the effect that a given medical solution is having on a population. So the idea would be to create a $6 billion fund, and this is the long-term plan, to which companies would register for specific products. So say you get 60 companies registering 60 products, each of which has an impact on a different disease. So one would be tuberculosis, one would be an antiretroviral, one could deal with diarrhea, and the idea being that each of these drugs, or each of these companies, I should say, would then be paid out based on the impact that those solutions have on a population. So if the TB drug had a much larger impact in Botswana than the diarrhea pharmaceutical solution had in Ghana, the drug in Botswana would have a greater payout to that company. The conclusion being that companies will now be motivated to produce pharmaceuticals and to distribute them and to educate the public about pharmaceuticals that have a greater health impact, rather than the current scenario wherein they're motivated by patent monopolies, marketing, and high drug prices, completely unrelated to the medical viability of their actual products.
So the innovation is also how to incentivize innovation in a new way, and doing so by recognizing there are market forces and levers of change that we need to engage with that are part of the power system, and looking at a systems level change, working with pharmaceuticals and that particular industry in order to advance health. While we still have Kat with us, can you talk a little bit about where you see the key levers of change in the policy world and how we can be engaging with that through ASAP, through Health Impact Fund, looking towards a new framework for ending poverty?
Yes, well, I think what Jake and Gilad have said just really indicates what the value add is to bringing academics to influence the development discussion. They really help us look at issues of justice and social justice and fairness in a different way. For example, it helps us examine the system of development aid in a different way. We in the foreign and development policy worlds tend to take certain things for granted. We take the system, the international system of nation states as we see it, whereas what they're doing is they're looking in a new, innovative way to say, where is it that we can actually change things? Where is it that the systemic incentives are unfair, that they need to be changed. So what is it that we as people in the West, affluent young people, where do we have a duty of care? Where do we have the duty to do no harm? And where do we have the duty to do good in the world? And how can we translate that into real action in our day-to-day? So, for example, the Health Impact Fund is a great example of that. There's also another great project called Giving What We Can that ASAP runs. And there's a project that they're also running which is looking at the resource and borrowing privileges that nation states have. These are all examples of how the system at the moment is set up to give a structural advantage, unfair structural advantage, to certain nation states and certain individuals in the world. And part of actually the process of tackling poverty is actually to understand that there's systemic unfairnesses in the system that need to be addressed. We that are so close to the system as it is, we find it hard to see these things. Academics with their more distant lens can really help challenge us and actually set out a vision for a world which is fairer and give us the tools and the insights to identify where we should be focusing our attention on.
That's really helpful in framing it. Thank you. And I want to move from that back to Gilad and looking at the perspective and unique role that that academics and scholars are playing through these kinds of innovative initiatives that attempt to redress, I would say, a systemic imbalance. So there is an unfairness, there is an advantage, but that we also we kind of load those terms with judgment and emotion, because it's emotional. We really care about this. But the bottom line is there's simply an imbalance that's not only not sustainable, it's dangerous, it's impractical, it's not strategic. So looking to redress the systemic imbalance and create systems level shifts, why and how are the academics mobilized through ASAP changing the framework of ending poverty? Help us understand a little bit about the progress made with Millennium Development Goals and how we might be moving to another stage in our global agenda to end poverty.
Sure. So, if I were to state very ambitiously what we're trying to achieve in the next 2 years.
Be ambitious.
Yeah, I mean, why not? It doesn't cost to be ambitious right now. So, but this is really what we're trying to do, and we think that we have a chance to do it, is getting into the new framework that will replace the MDGs after 2015, a completely new family of development goals, which were never before agreed by the world nation states. And namely, and really I'm taking here a point out of what Kat said, what characterizes the new kind of goals we want to put forward is that they are goals that set standards and targets not just for the recipients of aid, but also for the givers of aid, for the world's most rich and powerful states and institutions. And I'll give you a couple of examples to explain what I mean. So this all starts with a reflection that is now already becoming a consensus within academia, but is not yet breaking through to the public and political discourse. And that reflection is that when you look at what causes poverty globally, the causes are not merely local at the level of developing countries, they're also global. That is, they're also caused by the nature of the rules and the practices which are imposed globally by the world's most wealthy and powerful agents. I'll give you two quick examples. One, Kat just mentioned. So in our world, it is completely legitimate for a kleptocrats that just took over a poor country by means of force to borrow an indefinite amount of money on behalf of the citizens of that country, and therefore indebt them in perpetuity, or to sell all of their resources and take the profits directly to their pockets, again, at the expense and cost of the citizens living in that country in perpetuity. But it doesn't have to be that way. There could be a decision that internationally we do not buy resources and we do not lend money to kleptocrats. That's one example. Another example, in the world as it is now, there is no real international monitoring system to curtail the flow of illicit, to curtail illicit financial flows that if you look at the numbers, spirit away about $1 trillion every year from developing countries, money that could have gone to social programs. To put this in perspective, that's about $10 for each $1 that goes in to official development aid annually. So it dwarfs this loss, the benefits that are gained by official development aid. What we want to do is to take these issues where there are global factors controlled by the richest and most powerful and develop concrete goals, which are goals that need to be met by everyone and not just by poor people, and to have these goals be prominent in the new framework to replace the MDGs. And the way to do it, an urgent mobilization of academic resources supporting, evidence-based, supporting our claims and our recommendations, and a close collaboration with CSOs and with the UN.
So you say CSOs, we mean civil society organizations.
Sorry about the acronym.
Mobilizing all the players seems to be a common denominator in these projects. I want to turn to Jake to jump in here, and in particular, bring us back to what that global connection is. So when we have real impact in one part of the world, as Gilad was referencing from efforts to eradicate poverty, and that responsibility has to be global. How does that work with health in terms of the impact?
So, I mean, I think it's interesting because this is a good, very concrete example of how one can have an obligation that doesn't entail ambitious, quote-unquote, amounts of money on the part of any given country, whether developed or developing, but can have massive impacts for the entire world. And it's also interesting because here, while we're thinking about very innovative and groundbreaking solutions, the solutions don't necessarily involve a complete paradigm shift from, for instance, the existing patent system. So ideally, the Health Impact Fund would exist in parallel to the existing patent system, and countries would be donating a very, very small percentage of their GDP in order to both benefit their health systems and international health systems in a way that alleviates one of the most severe impacts of poverty these days. So for instance, pharmaceuticals have incredible margins on many drugs, but they're not making the margins they need on the drugs that would have the greatest impact on those in many of the neediest countries, and even those in some of the developed countries, but for whom there are no solutions right now that the patent system motivates a solution for. So the idea here is, sorry, go ahead, Diana.
No, keep going, I love it.
Okay, so the idea here is to try to come up with some sort of alternative that very much would be to pharmaceutical companies' liking, to the extent that they want to produce these drugs. In many cases, they've already done the research into solutions, into pharmaceuticals that would help problems, but are not motivated enough by the prices that they're going to receive for those drugs. In other cases, they know, for instance, based on basic science, that there could be a solution out there, but they haven't done the preliminary research to test those hypotheses because, again, they're worried that either developing countries won't have the money to pay, or in developed countries the markets will be too small, or the patent system won't protect the solutions that they eventually develop.
So then what happens, what's the consequence of not developing the drugs that we need? Can you tell us a little bit about how this impacts globally distribution of medicines in one part of the world affecting other parts?
Well, obviously there are massive inequities at this point. The amount of money is the classic 90-10 split, where the amount of money that is spent on those diseases that require, in many ways, the least attention, but affect those in developed countries the greatest, are receiving 90% of the funding, while those diseases that affect 90% of the world to the greatest extent are actually only receiving 10% of the funding. These numbers are ballpark, but the impact there is obviously very clear. We're devoting a massive amount of resources to medical solutions that are a much, much lower priority for the vast majority of people on this planet.
So how does that help avoiding drug resistance? What is can you tell us about what drug resistance means in this context?
So that's a really interesting example because, for instance, one of the pilots that we're proposing, and pilots here are a key concept to understand because we don't necessarily hope to jump into a $6 billion fund tomorrow. Instead, the idea is to test out the many hypotheses that lay the groundwork for this proposed fund. And then once we've tested them out, for instance, the ability to measure the impact on health, which at this point is a pretty widely understood principle, once those are all tested, then we'll jump into the fund. And so, for instance, one of the pilots that we've been discussing relates exactly to what you just mentioned, drug resistance, and in particular, resistance to antibiotics. So in this case, there's a variety of tuberculosis that's arisen in India that's receiving a massive amount of attention these days because it is almost entirely resistant to all antibiotics. It's a super disease, in essence, that has built up as a result of, in many cases, over prescription of antibiotics throughout India, a resistance to almost all antibiotics. And so the pilot here would be to try to test out a model that would both change the way that drugs are administered so that, for instance, doctors are educated not to overprescribe antibiotics, but also to change the way that drugs are delivered and in some cases even developed so that you can create solutions that are that would fix the tuberculosis for which at this point there is a complete resistance, i.e. create a new drug that will solve this problem.
Okay, so through the Health Impact Fund, by incentivizing innovation that's based on the impact you're having, a pilot in India, say, helps deliver results that will protect ultimately me in New York City from having that drug-resistant disease come back. Kat, can you just jump in and again put this in the framework of foreign policy and diplomacy? How does this shape the conversation and move levers of change?
Absolutely, thanks, Dana. What I wanted to kind of say was really that we have to remember that in 2015 we're very much in a different global situation than where we were in the year 2000. We're in a global turn down. I think Oxfam released some figures about 2 weeks ago indicating that past recessions would indicate that global aid would probably decline as a result of a recession by about 10 to 20%. So that's the big picture shift that we need to make sure doesn't happen. This is why, you know, showing impact, showing innovation, bringing these ideas to the fore is really important. But there's also another trend that is quite worrying, which is that money is being consolidated through big aid institutions that are pushing money out. Now, what happens is that innovation and small organizations get squeezed out in those circumstances. And let's not forget that rarely is poverty really to do with lack of money or lack of resources within the country. It's often very much to do with a situation about distribution. There are countries in West Africa where the GDP per capita is over $40,000. So the key issue is that we need to make sure that the aid industry doesn't just focus, and that when we give money, it's not just focusing on humanitarian aid or giving money to the aid industry. It's also about addressing these relationships of power within the country that mean that poor people are excluded from decision-making processes, that mean that the assets of the country, public services, for example, aren't invested in. And I think it's this systemic perspective of justice, of accountability, of actually listening to poor people, understanding what it feels like to walk on their shoes, why they can't access the resources and the benefits of their country. It's important to listen to them, and this is, I think, what a lot of these innovative small organizations do most effectively, because they build the relationships, they listen to different people, and I think that that's key.
Well, I really thank you for, in particular, not only giving us the context of we're now dealing with austerity measures and that's our reality, but also the need for the voice of those most affected, the real experts on poverty, those living it. And so I want to thank you for your voice and for joining us. I know you need to sign off. I'm going to continue a bit with Gilad and Jake while we have that time. So thanks, Kat. And we'll look forward to staying in touch, and people can get in touch with you from over here. You want to just give us your website?
Yep, we're www.FromOverHere.co.uk. And it was great to chat to you all. Thanks ever so much. Bring me on again anytime. It was great.
Okay.
Thanks. Bye.
Bye-bye. So, Gilad, tell us a bit about the voice of inclusivity, the efforts of ASAP to move forward inclusivity, and how the voice of all stakeholders comes out through these innovative processes.
Right. Before that, just I really want to respond to something that Jake said, about the severity of the global health problem and the urgency around it. So, one number really, really is kind of burned to my consciousness. There are so many numbers related to poverty, but one number really, really is always in front of me, and that number is 50,000. I'm sure Jake knows what this refers to. So 50,000 is the number of people who die daily because of diseases that are caused by poverty, diseases that people in rich countries don't die from, like, for example, diarrhea. It's been a long time since we've heard of somebody dying from a disease like that anywhere except from in the most vulnerable populations. And this thought that it's every day 50,000 people who are dying because of avoidable poverty causes, that I think really grounds our claim that this is not just important, this is actually as urgent as the problem can possibly be, if you believe that all human life is equally valuable. But to answer your question, so last time around, when the Millennium Development Goals were set, even though there was quite a wide process of consultation, it's very unclear that the voices of the actual people that are the recipients and are the people for whom the framework was meant were really engaged and really managed to have their voice be heard as part of the formulation. This time around, a lot of people are trying to do it differently, and especially make sure that poor people are engaged in a real way. What we're trying to do is, especially in the context of a process that's happening right now, the UNDP, the United Nations Development Program's consultation meetings in preparation for formulating the Millennium Development Goals, to ensure two things. One is that a representative group of poor people from around the world are present and involved at every stage of the consultation. Two, that inputs from these people get a priority and set the agenda for the international discussion. And three, that the engagement will be such as will lead to a practical and coherent policy recommendation from the global poor, and won't be merely an intellectual exercise or show the appearance of external legitimacy. And we're putting our resources, to get the best experts and practitioners in participatory consultation to plan the process, and to physically get representatives of the global poor to come to these thematic consultation meetings and to have their voice heard.
So given that these innovations are both urgent and pragmatic, let's talk a little bit about the pragmatic, both in terms of impact outcomes and in terms of the resources that you have. So maybe you could each talk a little bit about some achievements to date, and the next priority of how people can help. How can investors, philanthropic and otherwise, support these initiatives? Jake, why don't we start with you, and then we'll come back to Gilad.
Sounds great. So, I mean, I think in some ways this ties very nicely together what Katerina was saying earlier with regard to pragmatism, with what Gilad was saying immediately before I'm speaking now about urgency, which is to say that in some ways the Health Impact Fund is an example of the kind of project that ties into the urgency of obviously solving these 50,000 deaths, preventing these 50,000 deaths from needlessly happening, but also is pragmatic for the countries that will likely be footing much of the bill. So for the developed countries that are going to be paying for a substantial portion of this fund, and at this point the idea is to have them fund in a way that is proportional to their GDP, so everybody would be contributing to an amount that is, as I said, proportional to the amount of money that is produced in the economies of any of the given countries participating. But more importantly, they would also be benefiting their own health systems. And so in this respect, it's pragmatic. It responds to the austerity that we're facing now, as opposed to the outlook, the very optimistic outlook of the early 2000s, in the sense that developed countries will be optimizing their own health systems. Instead of paying for drugs large sums for drugs that don't have a huge impact on their own populations. Orphan populations within a given country for which who are facing illnesses for which there are no solutions, and drugs that at this point are far too expensive but have alternatives which have a very high health impact, perhaps not as high as the patented drug, but which would be motivated by a price subsidy such as the Health Impact Fund, would all of a sudden have solutions that at present don't exist whatsoever. So you have, for instance, poor populations in the Western world, in the United States, in Canada, and in Europe that don't have access to drugs simply because the prices are too high, because there's no way to motivate a decrease to the price of, for instance, the branded version when there is an alternative out there. And in the same way, we could spend less on our development assistance to developing countries by funding a system in which health solutions are created efficiently, as opposed to with the massive imbalances that currently exist, where, for instance, there are antiretrovirals that continue to be produced totally out of the price ranges of the populations that most need them.
So in effect, to create and invest in systems of healthcare, health delivery that saves money and prevents costly consequences for all of us, we shift from charitable aid and business as usual to real social investment. Gilad, you want to jump in there?
Well, unlike the Health Impact Fund, we cannot offer any yield on an investment. So, in a sense, ASAP is a social investment which is very much relevant to all generation philanthropy. But boy, can we deliver a bang for your philanthropy buck, is the thing. So, what we're doing with the post-MDGs is what you call, a high ambition, medium chances of success, huge impact endeavor. If you look at where to focus resources, I think one thing I can say with quite a lot of confidence is that nothing is going to have more impact, more widely, than what will replace the Millennium Development Goals. This will be the agenda for the next 2 decades. And I think that if we manage to pull together very quickly and urgently the resources needed to provide the right type of research and to connect it in the most accessible way to the policy debate, we just might change what that new agenda will be. And that's impact.
Well, it sounds like a good investment to me. And I thank you both for being with us today. Just to finish up, can you just tell us your websites and we'll sign off? Gilad?
Sure. It's academicsstand.org, or just Google Academics Stand Against Poverty.
Okay, thank you, Gilad. And Jake, tell us how to find your work.
So ours is equally simple, healthimpactfund.org. That's healthimpactfund.org. And again, you can Google either Incentives for Global Health or the Health Impact Fund, and you'll find a ton of information about our team and our project.
Terrific. Thank you so much for sharing these high-impact opportunities. We hope that we can fast-forward support for these important initiatives. Bye-bye now.
Thank you, Diana.